one thing I've saved money on during this COVID crisis, pandemic, whatever, my lipstick. Yeah. So, and then I've learned that all of my masks are stained from makeup. So anyway, and of course I have I Love Lucy mask as well. So, wow, I can't believe it's been a year. And I was talking to Dr. Long earlier talking about, you know, our statistics and all these things that we did in our master's program and thinking, oh, I'll never have to do that again. And then when we got into our DNP program and we had to learn SPS and all that. And then here recently I'm on the governor's, one of the committees there, and they were talking about all these statistics, and I'm thinking, I really am gonna have to do this. So anyway, so my project was, of course, with school-age children. As y'all kind of know me from the past, my passion is the school-age children and underprivileged children and families. And so mine was improving the health of school-age children and addressing social determinants of health. And so the definition, I'm not going to read to you guys, but you know, I thought it was very interesting that social determinants of health can either be a good thing or it can even be a bad thing. And so it can go both ways. And I believe they're looking at actually changing that. That was still kind of on the fence, and I think everything has come to a halt. But the main thing is promoting the health and wellness for everybody, okay? So our social determinants of health, there's 4 things that it affects: the finances, the access to health care, personal and family issues, and then housing insecurities. And I think we're all very familiar with that in the field that we're in. So the problem that I came up with was, because I have been so involved with Lubbock ISD as a former school nurse, was I talked to Paulette Rosnick, and I think probably a lot of y'all know her. And being a former school nurse, I saw a lot of need. And Ann Hackstrom and we started together actually in Lubbock ISD. And at the time that I did all of my research, it was in 2017 to 2019. And they had about 27,000 students, 28,000 give or take. And 64.8% were economically disadvantaged. Now, all of the LISD schools are Title I. Even the Miller School, that used to be the Murphy School, the more affluent school, Smith Elementary, Whiteside, those schools, they are all now Title I. 700 LISD students were homeless, and I'm sure that number is even greater now. And again, Title I, all of them get free or reduced breakfast and lunch, and now they also do dinner, okay? They also provide meals on the weekends, but that did find out, and this is something I was going to talk to y'all about, they're not going to be able to provide the meals during the Christmas break. And so that's a big hole in our population here. So the purpose of my project was to determine if a heightened awareness gained from participating in a poverty simulation would remain at 6 months post-simulation. And so, you can go ahead. I had to dive into the literature, and I was trained in poverty simulation back in 2014 down in Missouri. And it's called, it's a program that was actually started during Lyndon B. Johnson's presidential time. And he was very much a supporter of the welfare and helping, you know, people who needed help. And so this poverty simulation, and Lubbock Christian University does it with, I think Covenant does it, the undergraduate does it. They actually developed this program, and then the Missouri Action Committee, they actually bought it, rebranded it, and they've rebranded it a couple of times. And I'll go into that in just a minute. But anyway, so I needed to look into the literature and see, you know, is there a need? Our school nurses, do we have our biases? Do we really get what's needed? And is there a need? Or is it just Becky guys thinking, oh, we need to make this our project? So I went in, and it was very interesting to see all the entities from the college level all the way to, you know, public school nursing. I even found that some senators were invited to some of these poverty simulations. Interesting thing, they would leave before the constituents could say anything or ask any questions. I actually had the opportunity to have some of our key leaders in Lubbock come to a poverty sim, and I found the same thing. They graced us with their presence, and I'm not saying anything bad, but they did not want to be put on the spot. And so I thought that was kind of interesting. I even wrote to a couple of senators, and I had one of them I thought that was actually going to open up and talk to me about it, and then he realized I was from Texas and not even from his state, and kind of cut that. So anyway, my goal was to do it at the White House, but they didn't ask me to come. Okay. So what is poverty simulation? How many of y'all participated in one? Awesome. Okay. It's a huge undertaking. It has to be a big room, and you can click it so they can kind of see. Thank you. So as you can see on this left side, that we have a large room, and then the chairs are all set up in the middle, as you can see. So like the 4 chairs may be a grandma and a grandpa and 2 children, or maybe an aunt and a sister and 2 children. It's all set up with this very diverse families. And then on the right side, you have your rectangle tables that are on the perimeter, and you can see where those are your stores, like your bank, your grocery store, your community service, community outreach, your public school. So there's about 25 stores in your community. Whenever the participants come in, they're just randomly assigned a family, and they go to the chairs, and then we do a presentation, and then they have a week. They have 15 minutes to go do all the little chores that they have to do. Go to work, get your kids to school, go pay your bills, go pay your mortgage. And so 1 week is equal to 15 minutes. So we do this every 15 minutes. They go out and they have to find and try to accomplish the goals that they have. And they all are very limited on their money. And so when they first start out, they're all laughing and carrying on and thinking, this is easy or whatever. And by week 3, they realize this is hard. And when I actually did my training, I hadn't fed my children in 2 weeks, and I was going to have them taken away. And I realized all the chaos and the craziness, and so I saw these boxes. They were I thought they were empty, and so I thought they were props. So I grabbed one, and I went running back to my house, and I said, y'all, I stole food so we could feed the kids so we don't get them taken away. And they're like, oh, that's a good idea. So anyway, at the very end, week 4 comes by, then we're doing our debrief, and the lady came up to me who was one of the volunteers, and she was really homeless. They pay them a stipend, the homeless, to volunteer, and I had actually stolen her real food. Yeah, I was very embarrassed and very humbled. And I said, I'm clean, I'm so sorry I did not touch her food. I was very embarrassed, but I had no idea. So anyway, after the 4 weeks, after the 4th week, everybody gets back together, and then you debrief, and then y'all know that with stimulation, that's the most important part. I'm gonna get a drink real quick. Okay, we can go to the next one. So before I could do this, I had to go to the IRB and made sure, I had to make sure that everyone stayed anonymous. I had to do the informed consent. Everyone needed to know that they would be voluntary, and then when I finished with IRB, it became exempt research, but I still had to go through the whole IRB. So that was an interesting thing. So then I found my conceptual framework, and I liked Lewin's change theory. And so it's the unfreeze, change, and then refreeze. And I'll talk about this more at the end, but sadly, because of COVID, I think we're back to where we were. And I'll explain that here in a little bit. So we need to get back on this cycle again and see some change. So back in 2018, I did the poverty simulation. It was one of their workshop days with the LCU nurses. And they just came in, they wrote the name of the character on the top of their paper, not their real name. And then they did a Likert scale that came with the simulation. And we did the pre and then we did the post surveys. And so they had to rate their understanding of attitudes toward poverty and SDOH. Then 6 months later, I went back and the 94.3% of the nurses who took the surveys went ahead and did the 6-month post survey. And so I was really pleased with that. It would have been more, but some of them had resigned and then some had not participated. And so my whole thing was, did this make a difference 6 months later? Okay. So my methods was, excuse me, a descriptive design, and then we used the survey methodology. And the whole thing was there a long-term impact was assessed by asking the nurses to complete the 6-month post-simulation survey. We did a data analysis, and that was very interesting, working with our statistician, and I learned a lot through that. And so I'm happy to say it was a successful aim. And so, and I actually have it published through Nurses Made Incredibly Easy, if y'all want to read that and all the details of the data analysis. So we did the Fisher's exact chi-square, and you can see there was a 16.9% increase in our, when we measured it for our awareness. And then we did the stacked histogram, and again, we could see that there was definitely a change. But I'm afraid a year now has gone by, a little over a year, and I think we're back down. And so what I liked is that we did the qualitative analysis, and you can see my quotes here, and that to me spoke volumes. And I always remember Linnell telling us about, qualitative versus quantitative, and we had to learn a lot about that. And so I think that when I was in your class, you were finishing up your PhD. And so anyway, I always think about you, and I have to know the difference between the two. So, and again, I have it published so y'all can read the responses as well. And so, again, there was an impact. And I think what really was my wow was that one of the nurses who works, well, we called it project. I'm not sure what it's called now, but they're under, lock and key, basically. She went with the counselor, and they created a resource page for those families to help them figure out how they could gain access to resources that were in their community, and not just say, here's the paperwork, good luck to you. So I was very pleased with that. Then the other one that was very surprising and I was thrilled about was that at Whiteside, they identified they had some hungry children, and they actually created a closet there. And and it was interesting because even speaking to, like some of my colleagues, they were floored that Whiteside would have that need. And so, and one of the comments, was, oh my gosh, that's a good side of town. And, it can be anywhere. It doesn't have to be on one side of town or the other. And so to me, that was like, we need more education when it comes to, insecurities like that. And so, then the next thing, one of them, this one really spoke to me too, was that she had a different attitude toward her parents, and she wasn't so quick to judge. And, I even remember seeing the moms coming in, bringing their children, and they might be in their slippers and pajama bottoms. And, now realizing what I've seen and going through the simulations, that she may have just gotten off work, just thrown on some comfy clothes and trying to get the kids in the car and stuff like that. And so I think that was one thing that she said, I'm just not as quick to judge, and I'm kind of take a step back and see what I can do to help them. So we had a lot of discussion after, we had our 6-month survey, and we just really felt like it was a successful study, but yet, not only was it a study, we actually had something that came about. And so to me, that's what it was really all about. I had some limitations, and this one kind of scared me because it's interesting because the kit's been around for over 50 years, and no one has validated the surveys. And so I kept being asked about that, and I looked and looked, and I actually found 2 manuscripts that they had talked about it, but they never really concluded, and they never really had it done. And I got very close with the director of MACA, and she just said, we're just having so much turnover even in our own department that's the last thing on our radar is trying to get this validated. And so it was very interesting. It was because they sell around 1,500 kits a year. And when we first bought it, I think it was like $1,500. And now it's up to almost $3,000. But there's no oversight, so they don't really know they know who they sold them to, but they don't know if anyone's currently using them, if the people that are buying them are being trained to be a facilitator. And so there's a lot of things that could be cleaned up in that area, but anyway. I had a small sample size, but Lubbock ISD has 50 nurses, and I thought that was pretty good, but according to my statistician, I probably needed a little bit bigger. I probably should have done, more districts, or something like that, but for this, it was okay. And then I didn't even think about this, but some of the participants may not be fully engaged and may not feel like it was realistic, or they were there for a reunion to see their buddies and didn't take it seriously. So I feel like there's opportunities for more research. I think that this could be definitely done in more public schools, but also in private schools. I've been talking to someone who is interested in, putting a nurse into a private school and trying to figure out the difference between the state regulations and the private school regulations. It's kind of interesting. But again, the sustainability was the goal that I really wanted. And so I got it, but I'm thinking it needs to be expanded again. So in conclusions, again, you can see that the main thing is they were more aware of how to help their children manage and access care. And I think that's our biggest take-home message is that, care could be, dental, it could even be food, it could be even just clothing. You just got to get that access. Okay. One of the things, this was part of the thing that I had to say in my DNP, but I just wanted to point this out. I think all of us serve in our communities, and we don't do it, for another award or something that's prestigious. We do it because our hearts are into it. And I think that's with all of us. And so anyway, I really enjoyed doing this project. And again, I think post-COVID bucket list, we're going to need to jump back on some of these and help our communities rebuild, because I think we're going to see a lot of problems, suffering. Okay. And then here were my advisors and experts. And my acknowledgements, you can go through that. And then this is something that I'm just really passionate. We can't change SDOHs. We have to change our attitudes, and we have to work with them and to help our communities manage their health and their overall well-being. And I think we're all seeing that now with what we're going through. And my favorite thing, and Priscilla and I were in DNP together, and so we did a lot of traveling together, Austin and Dallas. And so every time we would stay at a home too, and it's a Hilton property, and I would always just giggle every time we would see this picture of these hands. And I was like, we gotta get a picture of me with the hands. And so I decided to use that as my theme, because we all have hands, we all can help, but we all have different hands. And it may not be your forte to to go to a food drive or whatever. But everybody, if we can just put our hands in, can help. And so next time if you're at a Home 2 Hilton property, you'll think of me when you see those little hands. So the other thing I wanted to tell y'all was back when I was a school nurse, it was a real cold day. It was cold like it was today. And a student came in and he was sick and he said, just didn't look good. And he said, I don't feel very good. It was Monday though. And Mondays we usually have tummy aches. And so I said, why don't you lay it down on your side, and then I'm gonna run next door and do a tube feeding and I'll be right back. He said, okay. So I was headed out, another little one came in. I don't feel good, Nurse Geist. And I said, lay down, lay on your side and I'll be back. So I went next door and I fed the little boy. And then I came back in and my two little sick ones with tummy aches were sitting on the cot. And they had saltine crackers just all over their faces. And they jumped and hid their hands behind their back. And I said, what are y'all doing? And the first little boy said, well, I was hungry and I was eating my crackers. And I said, well, I thought you said your tummy hurt. He said, well, you know that food that you send home with me on the weekends? I said, yeah. He said, I forgot it and I haven't eaten since Friday. And my buddy here, y'all don't feed him because he doesn't get a backpack. And I'm sharing my food with him today, and he hadn't eaten either. And so, sorry. I was like totally blown away because I've never gone hungry before. I mean, obviously, but I've never gone hungry before. And so I came home and I had told my husband what had happened because we were piloting the junior league thing where they were doing the backpacks on the weekends. And I said, they're not going to get food over the Christmas holiday. And we've got to do something. So at that time, we had 20 children who we identified, well, really 21, because we had missed that one. And so we decided with my mom, our little family, and then John's office, we talked to everybody. We all came together and we were able to get the 20 bags. And so it was wonderful. So then it grew and it grew and it grew. And now UMC's doing it. And they actually added another school. And then I was talking to Vern earlier, and he was saying that sometimes there's enough left over that they're able to get more at another school. And so I talked to the coach at Brown, where I was the nurse, and I said, how many actually do y'all have that will not get fed if they're not able to do it with UMC? He said 110. And so, but I was talking to Vern earlier, and he said that they're still, it's about $30 a child, right? $30 a bag.
$30 to supply them a bag of food for the Christmas holidays.
So, and then in my master's course, I did that same project in my community one, and I did it over spring break. And so, thankfully, UMC has started that. They do it at least 3 times a year. So kudos to, and in the Bible we learn about, just that little mustard seed. And to me, this was that little mustard seed and how it's grown. But again, I think it made me realize we've got a bucket list we're going to have to get started on post-COVID, And so that's something we're going to have to get started with. Okay. And there are my references. Any questions? I didn't mean to get emotional. Oh. Any questions?
That's okay, we were crying too.
It's hard not to get emotional.
I would like for Sigma to help out with this. So they're needing backpacks, and they're about $30.
Well, what we're doing at University Medical Centers, every $30, we put a plate on it. Instead, every $30,
Must stay away
we
from
buy a bag of food, or supply them with food for the holiday. If you can't give $30 to do, to do that, whatever you can give, they'll add to it. If somebody gives 10, somebody gives 10, or whatever, we're just gonna supply as many as we can for $30, you know, a bag, kind of like that.
I think we can do that.
Don't they meet Monday? Monday is our second Monday.
Yeah. Yes, we meet Monday.
And-
So I'm gonna talk to them about donating $3,000 to that.
Oh,
That would be,
That'd be wonderful. Our deadline to get money to this
Yeah.
project is 15th of December.
okay.
I think that's my deadline to turn in any
I
money.
think Monday's the 7th, but we meet at noon on 7th, on the 7th.
Get in contact with our legal department, with
Christy,
Christy, not Ward now, but, yeah.
yeah.
I'll let
Send
you
me some
know.
information.
She got married, so.
She got married, and I can't remember her name.
Because we've really been trying to help agencies, especially during COVID. It's been such a hard time. And since we can't go out and volunteer, this is one way that we can spend some of the money we have sitting in the bank.
Sure,
So,
And this is what we're doing during this pandemic, is what we usually do is people will bring food. And like, you'll go to Sam's and buy bulk stuff. And it usually takes 2 ambulances and a couple of the, you know, the Fox trucks, you know, for EMS to load this and take it all over to Brown. But in this time, what it is, you know, that's our support this year, or this, you know, for this season right now, is to do that, and then they'll take care of getting it to them.
And then who makes the backpacks and gives it to them?
I don't know if they're backpacks or whatever, but I know that the bags are gonna be supplied. I know that, like you're saying,
Bags.
junior leagues used to do, some organization used to give them a backpack, they bring back, it get filled, and they take it home on the weekends. I think that was
but
junior
this is
league.
like a
for-
That
box,
was,
this
yeah.
would be like a box of food. for
It'd be
the
like a
Yeah.
box of
holidays.
food for the Christmas holidays, yeah.
Through the food bank, I would bet.
I have no idea what,
They had their own food in it, the junior league, and it was at the South Plains Food Bank, is how they would box it all up. And that's the one where we piloted it around. But now y'all just use a bag, like those little clothy type.
yeah, we supply
Bags.
something, and I'm not
Okay.
involved in that portion, I just know that, you know, years past, you know, people just bring food, you know. We had a list of stuff and, you know, what they might need. You know, we're looking for mac and cheese, or,
Right.
you know, food that's sustainable, not unhealthy, but, you know, something they can get. And what we do usually at the beginning of the school year also is we'll do a school drive for them, and we'll bring school supplies. And, you know, it's again, it takes, you know, a couple ambulances, some trucks to, I mean,
Right.
we have huge amounts of donations come in for this.
If you could send me the information on who to contact.
Yeah, I
We'll
will.
meet- We'll meet Monday, we meet at 11. I think
Okay.
we moved it up.
Oh,
I'll try to send you something tomorrow too.
It's a board meeting.
Oh.
I'll
Just the
I'll
regular
text her
meetings
when
at
we get
12.
through,
Okay.
and
Yeah.
I think it's DeBus, but I just know Christy Ward, but.
Yeah, I can't think her name, last name now, she's married.
So, if y'all all recall, Dina Jeffries was over the Ronald McDonald House. She's now at the South Plains Food Bank. And so, kind of been talking to her, just kind of, you know, how are things going? You know, she's brand new at it. And she said they feed 300 to 400 a day at the South Plains. But, you know, that's not always accessible to, you know, and we really don't want our little ones walking, you know, to go get food. And so, but on the shack, the School Health Advisory Committee with LISD, the girl that runs the Airmark is phenomenal. And I mean, the food is actually, I mean, it's really good food. And so, but we haven't even met this year because of COVID. So all of our little programs we were doing through Shack are also on hold as well. So, yeah, but it's just, you know, last night I was doing our grocery shopping, and I came home and I told John, I said, you know, I think people must be really hurting in Lubbock. And he said, why? And I said, well, we're back to only one thing of toilet paper, one thing of, you know, the paper towels. I said, but I went to get soup, you know, and they don't have golden mushroom soup anymore. I haven't for months. And I said, all the ramen noodles were gone. I mean, it was just like this whole empty space. And then all of your less expensive soups gone. And I said, I don't know if people are panicking again or what, but a lot of your less expensive, less nutritional foods are like, they're gone. And, I don't know, it's just.
Even
it's
at the dollar
very-
store, I saw that. I was over there, I was just there to get a loaf of bread. I didn't want to go to the grocery store. And their food, of their cheaper items, they were all empty. And I thought, there's something going on. I thought the same thing.
I know, it's just this kind of, I don't know, but, okay.
Thank you, Becky. We
Well,
really
thank
appreciate your
you.
work.
Good job.
And it's so touching, we live in our bubble and we really don't think often beyond our bubble. We just do day to day, and there are people that are really hurting. My niece is a teacher in a Tier 1 school in Abilene, and she keeps lockers of snack foods and appropriate seasonal clothes for the kids. Because in the winter, there'll be snow on the ground and they're coming in flip-flops and shorts.
Oh, yeah.
And, it just breaks my heart, to think that those kids are doing without.
And my kids would go and they would refuse to wear jeans on a snowy day, and I'm like, I'm gonna get turned in. I mean, they're gonna think I'm a terrible mom,
Yeah.
And I mean, Anna can tell you, she was in middle school, I was in elementary, and the little kids, they would come where I was at, they would walk across Clapp Park by themselves at 7 o'clock in the morning. And, their mama she had no clue if they made it or not, that they didn't have a cell phone. And anyway, yeah, it's eye-opening. So, does anybody have any questions or?
So what are your plans with it? I know you'd like to probably do it again to kind of see where you are.
I would. I try to work with Paulette and do some type of educational thing with them. When I was in my DNP program, I had 2 policies changed. I actually got to go to the school board and behind closed doors, because we didn't want to cause any problem in the community or whatever. One of them was getting Zika added as an STI. And so we went and presented to 2 school board members, and the superintendent at the time was Burl Robertson. And they were like, absolutely. And so they included Zika into the curriculum, in the science curriculum for their sex education, so to speak. So we were excited about that. And then we did another one with the human sex trafficking. And so that's when we went and put all the stickers in the 2,500 bathrooms, And so they do mandatory education every year. And so that continues on. And so I feel like we need some type of mandatory continuing education, making us aware, of our biases that we don't know about, and also awarenesses of the social determinants of health.
Was the study just on the nurses? I mean, did you do your deal just on the nurses? Or-
Yeah, it probably could have been even expanded out to
Was it
the
the
counselors
teachers
and they actually own their own kit, Lubbock ISD, and whoever had done it before actually would take like a lower socioeconomic school with a higher socioeconomic school and put them together to try to bridge, that knowledge. But again, you've got to have someone who's wanting to do it,
You
and
mentioned
then.
private schools. Some private schools don't have, their teachers and secretaries and all that are being the nurse for those,
Right.
so.
I feel like, and I talked to Paulette, because I know they're doing contact tracing right now. And I think they may start, if they ever do, I don't know. But like, we could get in and help, maybe if they start doing, testing, in the schools. we could actually make videos, you know, so that they don't have to explain it every single time. I don't know if y'all been to CVS, like we go to pick up our prescriptions, and they have to say the same thing over and over. Give them a link, let them watch it before they go, ease their mind before they, you know, we have the resources. We could make a video like that and just click on it, and then you would still have to walk them through it, but at least, to me, if I had seen it it would ease my mind that, you know, they're not really sticking that all the way up my brain. I mean, I think that's what a lot of people think, but. So, and then the human trafficking, human sex trafficking, I mean, we're just gonna keep plugging away at that, and it's even at the college level. And so, I mean, I think we just don't realize it's just everywhere, and I think it hit pretty close to home a couple weeks ago when that 14-year-old was found, and
That was at Emerson School.
it was.
Yeah.
Oh,
It was super close to home.
yeah, and so I think I don't know, I think we've got a lot of work cut out for us. I think we gotta just get past COVID and then kind of pick up our pieces and see where our passions are and see where we wanna go. And man, that is, cause I was thinking 110, you know, and like, oh, I don't know if we can afford that many, but yeah, that's great. Any other questions?
So Becky, I was gonna ask a few, if you don't mind. So would you elaborate a little bit on what happened to the boys in your clinic?
Well, of course, I mean, they threw up because they had, you know, were so hungry and all, and I ended up getting with the teachers, and I had to do a little research myself to see what are the signs of hoarding, or how do you know if a child is hungry. And really our coach was probably the best person because she really saw a lot. I got in trouble because I would go down to the lunchroom and I would notice that all the kids would not eat their fruit. And so I was like, well, this is dumb, they're throwing it all in the trash. And so I got the fruit and I made a big basket, put a big bow on it, had it outside my clinic. And it was cool to get fruit from the nurse. I mean, everybody was eating their fruit. Well, I got in trouble because you're not supposed to circulate your fruit.
Yeah,
or
I'd
whatever.
rather it go in the landfill.
Yeah.
Oh my
Yeah.
gosh.
And so, but the girl that's over the Airmark thing, they do that now. And so they've kind of changed all of that up.
Plus, everybody would want to go to the nurse's station, even if they're not sick, to get
Right.
fruit.
I had it outside the door. You just walk by, you know, and pick it up. And so, but anyway, so we added that other little boy to the list. And then, of course, you know, our list grew and grew. And we did it, my family did it for 2 years. And then that's when legal at UMC decided to pick it up. And so they're probably in their 15th year, I think, 15th or 16th year of doing this.
That's wonderful.
Oh, yeah.
That's wonderful.
Yeah.
Thank you. You talk about sustainability. Can you address where the LISD nurses are now with their awareness and possible programs surrounding SDOH?
So, again, you know, you kind of put that to bed, and then you kind of start going, okay, you know, I need to look at this. And so I called a couple of colleagues and said, hey, you know, where are y'all with, you know, what you thought about the SDOHs and you know, the education. And, you know, we got so caught up with COVID when school started, it never even occurred to us. And I said, well, you know, if I can come help, of course they're not gonna probably let me in, but y'all probably need to look at that before the schools close, you know, for the Christmas break. And so I'm waiting to hear back from one of them on that to see if maybe we could fill her little pantry up, you know, and get some help there.
Good. Becky, you and I visited the other day and we talked about the upcoming holidays. I know you spoke a little bit about it, but can you tell me what is happening with the hungry children of Lubbock right now?
So again, I mean, Vern, you know, cleared that up from UMC. That'll be for Brown and Bean and maybe another school, and probably more now. with Sigma Theta Tau. Then the food bank, again, they're 300 to 400, but they have their holiday too. And so I looked at the Lubbock ISD website for the Airmark, and they are not feeding kids during that break at all. And they have, I mean, even Evans Middle School over there where you live and I live, they're not gonna have those food opportunities for those 2.5, 3 weeks. And so, I don't know, I'm gonna meet with Dina, who's now over the food bank, bless you, next week, and I'm just gonna talk to her and see, like, you know, how do we address this? I mean, because it's not good.
Did they give you an explanation as to why they're not feeding? I know they fed all over summer break.
They never have. I mean,
They
it's
never
just
had
never.
over Christmas break?
Yeah.
That's interesting. Becky, with the pandemic, I know both of our programs had to get creative for clinicals. How did you teach about poverty this year?
So I usually facilitate in Priscilla's program. I'm the facilitator for Poverty Sim 3 times a year. And then I bring my students in 1 time a year, because we admit once a year. And we couldn't do it. And so, you know, there's nothing out there. There's nothing out there that compares to seeing it live. We've tried videoing it. We have the little iPad that looks like he's on a stick. You know, if y'all ever seen an Ewok or whatever, we've tried that. I mean, we've tried everything, and even not just Texas Tech or, you know, Lubbock, other states have even tried, and you've got to feel it to get the full effect. So I looked at other programs like Spent, and I found a girl who had, she did her DNP, and it was pretty, her results were similar to mine. And so she had created kind of like an avatar type thing, and I got special permission to use it and everything. My students didn't like it. They liked Spent better, and where I felt like Spent was like a game. And so it was very different to see, you know, the different ideas. But what I did with my students was, I only have 24, so I broke them up into 4 groups, and then in groups of 4, and then we were on Zoom. And each group had a scenario, and they were scenarios that I had from my experiences and just some that I had made up. And they, you know, we had our pre-Zoom meeting, and then they had 3 hours to go out and find all these things that they had to get done, like you would, and I mean, they were panicking because they would call me, we don't know how to find this. So no, what if you were a single mom and you were at work and you were on your 15-minute break and you were trying to find, so it really hit home with them, and they were very humbled. And so then they had to put these PowerPoint presentations together and then present. Everyone had to present, so it was all equal, you know how you do. And they said they learned so much from that. And so I wrap it up with this story. Or was that your last one?
I have one more.
Okay. Well, remind me to tell you my favorite story.
Okay. So last question. What are you doing now with your passionate work in the community for helping our kids?
Well, I'm on the governor's board, and then here locally in the Texas Tech for the human sex trafficking, and I didn't realize that there's a huge movement out in the East Texas, West Texas. We're really not doing a whole lot. And so I'm kind of new in this, and so I'm trying to figure out kind of where I'm at and what I'm going to be doing. But I am teaching my students human sex trafficking in the same way that I did the poverty, and making them more aware as well. You know, I was talking to a detective this week who does human sex trafficking, and he said, you know, so many people think in their minds that it's like that they're beat up, and you know, he said it's so subtle. You don't really, I mean, that little girl was at your daughter's school. You have no idea. And so that's kind of where I've been working with that. And so, but the Hungry Kids still is just really more of my, I don't know, my passion, I guess. I mean, I want to do this other too, but feeding the little tummies just does something to me. So Can I have just one more story, or do we need to go?
No, you're good.
Okay. So I guess we'll throw our questions.
Yes, ma'am.
Okay. So whenever I was trained on the on the poverty simulation, I was thinking, how am I going to do this when I teach online, you know? And I thought, surely this is going to work. Well, we did it with the traditional students, and one of my students pulled me aside and she said, you know, Mrs. Geist, I'm so glad I went through this simulation. And I said, why? She said, well, we had a patient who was discharged, and then they were readmitted for the same thing, and they were worse than they were when they left. And my nurse that I was with rolled her eyes and said, yet another non-compliant patient. And she goes, I realized after we left there, that patient wasn't non-compliant. We failed them. We did not prepare them to go out and be successful. I was like, okay, you know, I was like, okay, there's something to this. Well, then that Christmas, it was around this time, and it was actually, they had already graduated, and it was really cold outside. It was probably like the December 23rd, and I get a phone call from one of my students like 11 o'clock at night, and I'm thinking, that's strange, you know. I don't know what to do. I'm freaking out. I'm like, okay, calm down, you know, what's going on? We have a patient who's homeless, and she's been discharged, and she doesn't speak English, and they told me to just go ahead and discharge her, put her in the taxi, and send her to the Salvation Army. But I remember just that from the simulation that there sometimes those places get full, because like our jail, you know, gets full. So I called down there, and they don't have any rooms. And she said, so I told the charge nurse, and she said, I don't care, just put them in the taxi, they can deal with it, we've got to get a bed. And I mean, we've all been there. We've all been there, you know, needing that other bed. And she said, and here's the kicker. She's Filipino, she doesn't speak English, and she's a nun. What are we gonna do? What are we gonna do? And I said, well, think about your resources, think about what you can do, you know, you need to follow the chain of command. And she goes, pastoral care, and she remembered that from the simulation. So she calls pastoral care, and of course the diocese, you know, got involved and they took her. And so I was like, yes, this is actually working. And so I hope we get to start doing it live again, but who knows? And so I really missed it, because we've missed a whole year.
Yeah.
Yeah.
That's awesome,
That's
Becky.
it.
Thank you.